Michael, then Chad.
You said in your remarks, Democrats have been clear about where we stand on government funding. Republicans say the same thing. They say they've been clear about where they stand, and they don't believe that these ACA premium tax credits should be a part of the CR. Speaker Johnson, Leader Thune have both said that they're willing to have this conversation in November as we get closer to the deadline. I'm curious how you square the Democrats' position, saying you're clear on where you are with government funding, with the Republican position of they don't think that this issue should be attached to a CR, and they think that it's something that should be negotiated and discussed later.
Michael, they are in control. They control the House, the Senate, and the White House. Republicans control it. It is on them to put a plan that funds government to the table. They have chosen not to engage Democrats. So my assumption is that they have the plan and they have something that has the votes. I don't know why you wouldn't engage when you need a bipartisan solution, why you wouldn't engage with the other side, why the president still hasn't met with the four legislative leaders, why the four legislative leaders have not addressed this issue, and Democrats and Leader Jeffries' attempts to try to meet with Republicans have not happened. That isn't it. It's not on us. They clearly must have a strategy or a plan because this is on them. If they don't want to address the impending healthcare crisis, they can explain that. But they control the levers of government. It's on them to put forward a plan that funds the government.
So Chairman Aguilar is absolutely right. Republicans control the White House, the House, and the Senate. And if they want to decimate healthcare, well, they have the right to do that as a majority party. They just have to be able to pass their laws, their bills into law as a majority party. If they can't do that, then they've got to present bills that I would vote for. And if they're not going to do that, I'm not going to vote for it. It's pretty simple, right? But the reason that we're fighting for health care as Democrats is because these are life and death issues. If you can't afford medication for your disease, if you can't pay for health care that's, harming one of your family members, it could affect life and death issues. It could harm people. And it's even more than that. As Chairman Aguilar said, you've got hospitals shutting down. You have massive cuts to treatment for people who are in cancer trials. You have research of cancer being cut. Like, why would Republicans do that? And that's why Republicans need to reverse course and why Democrats are fighting so hard on healthcare issue.